Hello friends, welcome to the channel. So today we will be discussing about respiratory system. This will come in series and today we are having part 1 which we will specifically discuss about anatomy and physiology of the respiratory system on a whole. Now, this video could be very helpful and important for all the nursing aspirants who are preparing for various competitive exams, whether for a nursing officer or nursing tutor, or even if you are a nursing student and you're preparing for your exams in academics. So, in that case, also, you can look up to this video for your reference. So, let us start. So the first part we will be discussing about the anatomy and physiology of the respiratory system. Now, the respiratory system on a gross division has two functions, primary function and the secondary function. The primary function of the respiratory system includes number one, the provision of oxygen for metabolism in the tissues. Second, it removes the carbon dioxide and the waste product of the metabolism. Next comes the secondary functions. The secondary functions of the respiratory system includes number one, it facilitates the sense of smell. It helps in production of speech. It maintains acid-base balance as well as it maintains body water levels and maintains the heat balance in the body. Okay, so this was the function of the respiratory system on a whole, right? Next we will be discussing about the anatomy. Like for knowing the anatomy, we should come across the gross division in which we divide the respiratory system, right? So the respiratory system is on a gross divided into the upper respiratory system and the lower respiratory system, right? Number one is the upper respiratory system. The upper respiratory system consists of the nose, the sinuses, right? Next is the pharynx, the larynx, and the epiglottis. Okay. Whereas the lower respiratory system consists of trachea, the mainstem bronchi, the bronchioles, alveolar ducts and alveoli within the lungs, right? So let us start with the upper respiratory airway. The upper respiratory airway starts with the nose. The nose humidifies, warms, and filters the inspired air. Next is the sinuses. What are the sinuses? These are air-filled cavities within the hollow bones that surround the nasal passage. Okay, and what is their function? They produce resonance which will help in speech production. Okay, next is the pharynx. The pharynx is the passageway for the respiratory and the digestive tract, which is located behind the oral and the nasal passage or the cavities, right? Next is the division of this pharynx. So the pharynx is divided into nasopharynx, oropharynx, and the laryngopharynx. Next, we are coming to larynx. The larynx is located just below the pharynx at the root of the tongue, and it is commonly called as the voice box, right? So this is the larynx, which is also called the voice box. It is present at the root of the nose, right? It will contain two pair of vocal cords. One pair is false and another pair is the true vocal cord. The opening of the true vocal cord is the glottis. So this is the opening of the true vocal cord, which is called the glottis. The glottis will play an important role in the respiratory system. Why? Because it is helpful in coughing. It is the most fundamental defense mechanism in lungs. The epiglottis is the leaf-like cover or flap structure at the top of the larynx. It prevents the entry of food into the tracheobronchial tree and by closing over the glottis at the time of swallowing. Okay. So after this, we are coming to the lower respiratory tract. So this is the lower respiratory tract. The lower respiratory tract includes number one, the trachea. So this is the trachea. The trachea is located in front of the esophagus and it branches into the right and the left mainstem bronchi. So this is the right and this is the left mainstem bronchi. Now the beginning of the bronchi starts from the carina. So this is the portion which we call carina. So carina is the starting point of the mainstem bronchi. The right bronchus is slightly wider than the left bronchus and it is slightly shorter than the left one. So this is the right one. This is comparatively wider and shorter than the left one, and it's more vertical. This is again divided into secondary or lobar bronchi that each and enter each of the five lobes of the lung, right? So these main stem bronchi again divide into secondary bronchi or the lobar bronchi, and then they will enter the various lobes of the lung, right? The bronchi are lined with cilia. So these bronchus in the inside are lined with small projections from inside. These are called cilia. This cilia propel the mucus up and away from the lower airway up into the trachea so that it could be explorated, either thrown out, expectorated, or that could be swallowed into the digestive tract, right? Next, we are coming to the bronchioles. The bronchioles, these branch from the secondary bronchi and subdivide into small terminal or respiratory bronchioles. So these are the secondary bronchioles that entered the lobes. Now, from these, again, what happens is the again branching will occur, and this branching, what will happen, this branching will again go into smaller terminal or the respiratory bronchioles, right? These bronchioles, the terminal or the respiratory bronchioles, do not contain any cilia or even no cartilage. Okay, the terminal bronchioles do not participate in the gaseous exchange. Next is the alveolar ducts. Now, the alveolar ducts is the term, or the acinus is the term used for all the structure which is distal to the terminal bronchiole, right? Now, this alveolar sacs which rise from the ducts are cluster of alveolus. So these are the terminal bronchiole, and away from this is these are the alveolar ducts, right? Now these alveolar sacs which rise from the ducts that contain the cluster of alveoli. So these are the cluster of alveoli, and these are the basic units of gas exchange. So these alveolus are the basic units of gas exchange. Okay, there are two types of alveolar cells in the walls of the alveoli that will secrete the surfactant, that is a phospholipid protein. So this surfactant which is being produced inside the alveolar cells, that will help to remain the alveolus inflated and will prevent it from to collapse. Okay, so without surfactant the alveoli would collapse. Next, we are coming to the lung. So these are other lungs. So inside the lung will cover all of these structures which we just discussed. So the lung is located in the pleural cavity. This is the pleural cavity in the thorax, and it extends just above the clavicles and to the diaphragm. Here is the presence of the diaphragm. Okay, the major muscle for inspiration. The right lung is larger than the left. So this is the right lung, and this is larger than the left lung, and it is divided into three lobes. Whereas the left lung is a smaller one as compared to right one and is divided into two lobes because of the presence of heart in the left side of the thorax. The respiratory structures are innervated by phrenic nerve, vagus nerve, and the thoracic nerve. So these three nerve names, you should take a note of this. The respiratory structures, what are the nerve system that are innervating this, is number one phrenic nerve, number two is vagus nerve, and number three is thoracic nerve. Next is the parietal pleura lines the inner side inside the thoracic cavity, including the upper surface of the diaphragm. The visceral pleura covers the pulmonary surface. So inside is the parietal and outside is the visceral pleura in the pleural cavity. Now there's a thin liquid layer in between these two pleura so as for the lubrication, so that the entire breathing process or respiration occurs without pain. So there is a painless gliding or moving over each other, right? Now accessory muscles of respiration, it includes the scalene muscle which elevate the first two ribs. It includes sternocleidomastoid muscles which rise the sternum. the trapezius and pectoralis muscle which fix the shoulders. So what are the accessory muscles which we must take note of? Number one, scalene muscles which will help to elevate the first two ribs. Number two, sternocleidomastoid muscle which will raise the sternum. Number three is the trapezius and the pectoralis muscle which will fix the shoulder. So here what are the takeaway points in the anatomy? So the anatomy of the entire respiratory system is that on a gross basis we divide it into two parts: the upper airway and the lower airway. The upper airway starts from the nose and ends up in the larynx, and after the larynx till the end of the lung at the diaphragm we have the lower respiratory system, right? Now, the important nerves which will innervate the respiratory system are phrenic nerve, vagus nerve, and thoracic nerves. And the important accessory muscles which we must take note of is number one, the scalene muscle, the sternocleidomastoid muscle, the trapezius muscle, and the pectoralis muscle. Okay, so this is the about the anatomy. The important point is that the actual gaseous exchange takes place at the alveolar sacs, which comes from the alveolar ducts, which is distal from the terminal bronchiole. Okay, so over here the entire gaseous exchange takes place. Okay, and next we are moving on to the physiology, right? So the physiology of the respiratory system. So, how is this entire respiratory process being carried out? So, what happens is first the diaphragm descends down into the abdominal cavity during inspiration. So, there is a descent of diaphragm. So, when the diaphragm descends down into the abdominal cavity, the thoracic area or the thoracic cavity increases. When the area or the entire volume of the thoracic cavity increases, that will lead to the formation of a negative pressure inside the thoracic cavity. So this will pull the air from the atmospheric area inside the thoracic cavity. Why? Because the has a tendency to move from a area of higher pressure to an area of lower pressure. So because of the creation of the negative pressure, the movement of the air will be from outside, that is from the atmosphere, to inside, that is into the lungs, into the thoracic cavity, right? In the lungs the air will pass from just starting from the trachea, then through the uh, bronchioles and the term into the secondary bronchioles, and then going into the alveolar ducts and till the alveoli. At the alveoli there will be the exchange of air, the exchange of gases. So the oxygen will be diffused out into from the alveoli into the capillaries where the oxygen concentration was low, and in exchange the carbon dioxide will move into the alveolar sacs because the alveolar sacs initially had a low amount of carbon dioxide. Now, after the gas exchange has happened, the lungs will recoil. The diaphragm will relax. The intercostal muscles will relax, and as a result, the thoracic cavity will decrease. The volume of the thoracic cavity will decrease, and that will lead to an increased pressure inside the thoracic cavity. That is, a positive pressure will be there inside the thoracic cavity. Now, as the pressure inside the thoracic cavity is high as compared to the atmospheric pressure, so the air will now be pushed out from the cavity to outside environment. So this is the way in which the entire respiratory process will be carried out, right? So let us just have a revision. So this was the anatomy. On a gross we are dividing the entire process or the entire system into two parts. First we are having starting from the nose, then we are moving on to the sinuses. These are the air filled cavities inside the bone that will help in speech resonance. After that we are moving to the pharynx, and then the larynx, which is the voice box, and up to the larynx is the upper respiratory tract, and the lower respiratory tracts from the trachea, and which again divides into the secondary bronchioles and the bronchi, and then this will again branch into smaller bronchioles, and that will end up into the alveolar ducts and ultimately alveolar sacs, where the entire uh, gaseous exchange process will take part, right? And next is this, the physiology. The physiology is basically the descent of diaphragm leading to the creation of the negative pressure and the movement of air from outside to inside, and the gaseous exchange takes place, followed by the recoiling of the lungs and creation of a positive pressure inside the thoracic cavity, and then ultimately the movement of air from inside to outside, that is the expiration process, right? So thank you. If you like the video, stay tuned to the channel, and I'll be coming back with part 2 of this series.